The actor was found dead in a jacuzzi where it appears he has drowned.
What I wanted to do in piecing this video together is to connect with you that mental illness and physical bodily illness are going hand in hand, and one feeds off the other and vice versa. But the important thing here in this video is you're going to learn about what caused the entire problem to start in the first place, which I don't think enough people are talking about.
He'd spent the morning very active, playing pickleball for a few hours, came home, sent his assistant out on an errand, and when the assistant returned a few hours later, he was found in the jacuzzi.
Dr. Sanjay Gupta, cardiologist and heart specialist. Professionally speaking, what is the likely cause of death for a 54-year-old man who was found in his spa?
Okay, so I'm introducing Dr. Sanjay Gupta because I really like him as a cardiologist, to hear his opinion.
The most common cause of death in middle-aged men is heart attacks, sudden heart attacks. So, if someone said, as a betting man, where would you put your money for middle-aged men to drop down dead or die suddenly? It's usually sudden heart attacks. And often they don't actually give you a warning. So the first warning is the sudden death, not just the alcohol, but also the stresses. And Matthew, unfortunately, had problems with his weight and prescription medications, as far as I'm aware as well. So all these things will contribute. They're all very inflammatory to the body. And we know that heart disease is a consequence of chronic inflammation.
Okay, so I agree with Dr. Sanjay Gupta that all of his lifestyle contributed to his death. But what I would like to share with you is what started it all, because it really wasn't Matthew Perry's fault what happened to him. And you'll see why in a moment.
I was a colicky kid and I used to cry all the time, and I was constantly crying.
For those of you who don't know what colic is, it is severe pain in the abdomen due to gas or an abdominal obstruction. And what ended up happening, unfortunately, to Matthew Perry is back in the 70s when his parents took him to the doctor. Hear the unfortunate treatment that the doctor gave him.
And my parents took me to a doctor, and he was an older doctor, and he wore a white coat, and he said, if your baby's crying, just give him this. And they said, okay. And it was phenobarbital, which is a major barbiturate and a very addictive thing. And I was 30 days old. And they gave it to me for 30 days. So from 30 to 60, and there's pictures of me looking like knocked out. Like my face was all squinched. I was like, I know that it affected my sleep forever. I don't really sleep that well, and I'm pretty sure it's because of that. But if I was a parent and it was 1970 and I was given this by a doctor and the baby stopped crying, I would do it too. But, now it's like, are you fucking crazy?
And this is where I say it was not Matthew Perry's fault when he ended up addicted to drugs later on, alcohol in the beginning. So let's hear more about his journey.
The book is Friends, Lovers, and the Big Terrible Thing. Of course, the big terrible thing being your experience with addiction.
That's right.
Other people seem to be responding to booze this way, and I'm responding in a different way.
Yes, but I didn't understand it at all because I was 14 years old.
He's 14 with his Canadian pals and a common teenage rite of passage.
I'd never drank before, and I just sort of drank this entire bottle of the wine, and I lay in the grass and just was in heaven. And I thought to myself, this must be the way that normal people feel all the time. And I thought that at 14.
His friends could drink and stop, but for him, the relief was so easy it became his destination.
So let's discuss what had happened. When he was just 30 days old and he got prescribed a barbiturate, his body became accustomed to that drug at such an early age. And he was on that drug, as you heard. After the first 30 days of his life, he was clean. Next 30 days of his life, he was on a barbiturate, phenobarbital. That set the stage for him to have easy addictions later on down the road, because he spent half of his first 60 days of his life on a barbiturate. And therein lies the problem, where all drugs have side effects. Maybe not right away that his parents could see, but obviously in Matthew Perry's life. Again, which is why I say his journey was not his fault.
All racket sports I kind of excel at because I played all the time as a kid. So at one point I was a nationally ranked tennis player, boys under 14. I was 17th in the country, in Canada. I want to work out. I want to play pickleball. I play it almost every day.
The reason I show that he was really into racket sports was to show that even when he was young, he was very athletic. So it wasn't like he was an unhealthy child, but he had this predisposition to getting addicted to drugs based on the fact that he was on that barbiturate at such a young age. And again, let me remind you, that barbiturate that the doctor put him on for colic was not going to cure the colic problem. It was just masking the symptom of him crying, which is why I have a problem with a lot of medications, even in 2023.
It's a progressive disease, so it gets worse and worse as you get older. You know, by the time I was 18, I was drinking every day.
Then he mentions the true fact that as you get older, things tend to get worse. And that happens with weight gain, with health problems, you name it. As you get older, your body gets less able to handle what's going wrong with it. It's less resilient. Then we end up at this point where he's making a movie with Salma Hayek called Fools Rush In. And during that movie, he took a break. He was on a jet ski and he ended up having a collision with somebody. So obviously he got hurt. And what happens when you get hurt? You usually get put on painkillers. So there went his opportunity now to get addicted to opioids.
I would go to open houses and go to the bathrooms in the open house and see what pills they had in there and steal them. And I think they thought, well, there's no way that Chandler came in and stole from us.
Okay, just so you guys understand that the reason he had to steal the opioids or the drugs from other people's homes was because doctors are only allowed to prescribe medication up to a certain point. And after that, they can't prescribe anymore, or quote unquote, the person can have bad side effects from it. So his doctors had exhausted the ability to give him more prescriptions, so he had to go seek it out on his own. It wasn't that he didn't have money for it, because he certainly did. It was drinking, and then it was opioids, and then he ended up at cocaine. When you can't get opioids, which are a prescription drug, people turn to street drugs to get the same effect, which is why cocaine came into play.
You can track the trajectory of my addiction if you gauge my weight from season to season. When I'm carrying weight, it's alcohol. When I'm skinny, it's pills. That's a guy that's out of control. I didn't know what was going on with me. I weighed 155 pounds, on my way to 128 pounds. Well, I didn't watch the show and haven't watched the show because I could go drinking, opiates, drinking, cocaine. Like I could tell season by season by how I looked.
Because of Friends, was completely economically independent, one of these people who truly would never have to work another day in his life. And often when people have these addiction battles, they lose all their resources. He didn't. At least he was careful with that.
Half of your life, you say, in treatment centers or sober living facilities, you've dropped $9 million in an attempt to remain sober, and Meryl Streep was not there.
And Meryl Streep was not there. No, I had to give up, you know, this amazing movie that the biggest movie I've ever gotten. I had 4 scenes with Meryl Streep.
He cannot perform in this movie, and imagine how many millions of dollars he lost not doing the movie, not to mention all the millions of dollars he put forth to try to regain his life back again.
I had this dental emergency where I had 3 bone spurs in my mouth, and they had to be removed right away. I knew that there was something off with me because my mouth was on fire, but I also knew that I had to show up at this reunion. There's so many people where I can't move it, I can't change it. So I basically went and did the best that I could, but I was on like 6 cylinders, not 8, you know? I got CPR, and the guy who saved my life broke 8 ribs in the process.
And may I ask why you were getting CPR?
They were doing a procedure because I had pain in my stomach, and they gave me propofol.
Sure, that stuff like for
Yeah.
colonoscopies.
Yeah, all that stuff. And my heart stopped for 5 minutes.
The fact that he ended up having bone spurs is an indication that his body was deteriorating. And obviously, when someone gets CPR, not everybody has their ribs get broken. I believe that the ribs were broken because his body was already starting to break down for him to get more broken ribs than normal.
I was taking 55 Vicodin a day.
Okay, now he's admitting to the fact that he was taking 55 Vicodin per day. That is a huge amount, and Vicodin is a very strong painkiller. And you'll see now what it ended up doing to his colon.
Survived 14 surgeries after a nearly fatal emergency 4 years ago.
They ran me into the emergency trauma room, and it was in there that my colon exploded. I was put on an ECMO machine. It's what doctors and people call a Hail Mary. It works occasionally. 5 people had an ECMO machine that night, and the other 4 died. And my parents were told that I had a 2% chance of making it through the night. So I'll have to live the rest of my life knowing that my parents heard those words.
He was in a coma for 14 days. As he heals from all he's been through, there's still wear and tear on his voice and speech, and the scars on his body like a warrior back from battle.
Like I vomited into my respirator, and you talk to anybody in the medical profession and go, that guy's dead. There's no way that guy with that combination of things survived. I was in that hospital for 5 months. You know, we were told by doctors that I was so messed up down there that they couldn't even operate for another 1.5 years until everything was okay enough to go back in. And so I had to live my life that way with really unfortunate things happening. And
so when they talk about not being able to do surgery for a long time, imagine what your life would be like if you didn't have your colon useful to you for a very long time. That meant a lot of other things that he had to do in order to take care of the waste coming out of his body.
He turned me around and said, just remember, it's not your fault. And I went, what? He said, it's not your fault. And I went, say that again. It's not your fault. And I said, what do you mean it's not my fault? I'm the one who's doing it. What do you mean? And he explained addiction and alcohol to me, and he saved my life because I then knew that it wasn't my fault, that I wasn't weaker. It wasn't my will that was screwed up. It was that I have this disease and I need to get help.
Okay, and this is where I'm going to totally agree again with him that it's not his fault. And I'm agreeing actually with his, I think it's his Alcoholics Anonymous coach who was telling him it wasn't his fault. And it is true, it's an addiction, and the addiction comes from somewhere. And obviously by the beginning of this video where I showed you he was put on phenobarbital at 30 days old, there's where the addiction started. And again, it wasn't his fault nor his parents. It was the fault of the doctors covering up a symptom rather than taking care of the actual problem. And I'm going to take it a step further and say, here we are in 2023 and doctors are still giving prescription drugs for symptoms rather than reversing disease, which is a huge problem. And that's the reason why a lot of people, once they get put on a drug, they never get off of it.
Reagan had this slogan that said, just say no.
Just say no, yeah.
And you're like, well, idiot. If I could just say no, I wouldn't have to go to 9,000 AA meetings. I'd just be at home saying no all the time.
And herein lies the problem with the Just Say No campaign. I remember it. It just sounds so simple, just say no to drugs. But what they're saying when they tell someone that is they're negating the fact that there's an addiction going on. And if you don't manage the addiction, just saying no is not going to help anybody.
So just to end this on a good note, there are people that will help you and get their help.
Okay, and Matthew Perry is right. There are people that will help you when they know how to handle your situation. So at the end of this, there's a number that you can call if you're struggling with addiction to drugs or alcohol. But what I want to say before that is also, when it comes to your human body, there are many things that are going wrong in the body that can be reversed. when you don't get medication just to cover up the symptoms. So if you're a man who's over the age of 50 and you have health problems going on that you want to get reversed, click the link below this video. It's my calendar. You can get on that and talk directly to me about what your particular situation is. And then we can see what your options are. And I look forward to talking to you on the other side.
If you or someone you care about is struggling with substance use disorder, there is confidential, free help available at findtreatment.gov.